Good morning. Welcome once again to Alchemy Wellness. Today we are going to be touching upon a very important topic. This everybody is aware of. It's diabetes. Diabetes na ellarkum theriyum, sugar ellarkum theriyum. Everybody checks the sugar levels. இப்போ வந்து even they don't ask the doctors, they go to their different labs online. அவங்க வந்து sugar check பண்ணிட்டு இந்த values இருக்கு அப்படின்னு then a lot of people come to us with the reports. So நம்ம வந்து reports open பண்ணி பார்க்குறோம். Sugar levels, fasting sugar levels பார்க்குறோம், PP sugar levels பார்க்குறோம், HbA1c levels also the labs are providing these days. இப்போ இதெல்லாம் பார்த்துட்டு then we give the advice accordingly. Sugar இருக்கு, sugar இல்ல, borderline இருக்கு, whatever it is, we advise the patients. இப்போ உங்களுக்கு வந்து diabetes அப்படின்னு ஒன்று இருக்கு, அதுக்கு நீங்க மெடிசின்ஸ் எடுத்துட்டு இருக்கீங்கன்னா do you actually know what are the things you can do to keep your health in good conditions? In screening parameters னு சொல்லுவோம். என்னென்ன ஸ்கிரீன் பண்ணணும்? இப்போ diabetes னு இருந்தா then there are other illnesses which go along with diabetes. For example, diabetes patients invariably develop deficiencies of vitamins. They also develop thyroid problems as they go along. So, நீங்க at least once a year you should check for your thyroid function. Similarly, diabetes la vandu complications vandu it affects the eye, it affects the kidney, it affects the nerves and everything. Adu vandu eppadi screen panna poringa? You should ask your doctor how to check for these kind of complications which happen. First thing vandu diabetic foot care. Foot care is very important. Foot care la vandu self care is most important. Neenga vandu and the foot you should self examine the foot. Edavadhu ungalku problem nu therinja you should seek medical advice. Foot care is very important diabetes because உங்களுக்கு sometimes இந்த sensations நரம்புக sensations வரலன்னா you may be having a diabetic foot ulcer or some issues which can go on for a long time causing long-term damage. Every visit you make sure that you ask your doctor how to manage and check the foot care because there are various ways of checking the foot care using monofilaments, using pressure scans and the mari nariya foot care can be done. Second thing is eye checkup. Diabetes la vandu diabetic retinopathy means it affects the eyes. Usually the eyes are affected before the kidneys or the nerves are affected. So diabetic eye check evlo frequent ah pannum? At least once a year. You should go to a very good eye center close by. If your diabetic doctor is not having the eye center in his setup, ninga poitu now most of the diabetic eye centers they have an option of taking fundal photographs, the pictures. So on the picture எடுத்து store பண்ணி வச்சுப்பாங்க. So when you go for a follow up a year down the line என்ன changes இருக்கு அப்படிங்கிறது they can identify. Diabetic eye check போறதுல இன்னொரு advantage என்ன அப்படின்னா the microvascular complications of diabetes can be picked up very early and can be treated and managed appropriately. And the other thing which always we check as a routine is the urine microalbumin. If the kidney is leaking protein, this can be also managed appropriately. So உங்களுக்கு diabetes இருக்கு, நான் every 3 months டாக்டர் கிட்ட போறேன், HbA1c பார்க்கறேன், மருந்து மாத்துறாரு வந்துடுறேன். That is not the be all and end all of management of diabetes. நீங்க வந்து yearly once or at least once in 15 months ஒரு thyroid function check பண்ணணும். Yearly once at least you should get your eyes checked. Every visit or every 6 months you should make sure that your foot care and your urine is checked for albumin. So these are very basic things what you should be aware that you should be doing to keep your diabetes in good check. And if your doctor is already doing these things to keep your diabetic record perfect, that's fine. இல்லனா நீங்க கண்டிப்பா வந்து டாக்டர் கிட்ட கேட்கலாம். இதெல்லாம் கேட்டாதான் this completes the holistic diabetic approach in any patient so that your health is in good hands. Thank you.